Welcome to today's webinar, Walking Toward a Healthier Maryland, hosted by the Maryland Department of Planning in coordination with the Maryland Department of Transportation and our many Walktober partners. My name is Michael Bayer. I'm the Manager of Infrastructure and Development at the Maryland Department of Planning and host of the Walktober Walkinar series. Walking is an activity that many of us take for granted, but as pedestrian accident rates continue to rise and access to safe pedestrian spaces is diminished, communities are recognizing that walking and improving the walkability of our neighborhoods requires public attention and action. Throughout October, the Maryland Department of Transportation, in coordination with several state agencies and other partners, is sponsoring a series of webinars or walkinars to highlight how we can collectively rally around walking, an activity that is both central to the state's active transportation efforts and a critical component promoting public well-being. This is the second in a four-part series that we are hosting every Thursday this month. Thank you for joining us today. For more information about Walktober, please visit mdot.maryland.gov/Walktober or visit smartgrowth.org and click on the Walktober Walkinars link. We will be adding more information to this Walkinar page throughout the month as we continue the series. We are recording this webinar and will be posting it online. All participants today will receive an email with a link to the recording once it is posted. The Maryland Department of Planning also hosts a national webinar series in association with the Smart Growth Network on smart growth and planning topics available for viewing at smartgrowth.org. We encourage you to visit the website and to subscribe to our e-newsletter for smart growth and planning news and to learn about our upcoming webinars. You can also find out about planning initiatives, planning tools, and educational opportunities in Maryland by visiting the Maryland Department of Planning's website at planning.maryland.gov. The views expressed in this webinar are those of the speakers and not necessarily of the Maryland Department of Planning, the Maryland Department of Transportation, or the state of Maryland. Viewers of this live event are eligible to receive 1.5 CM credits from the American Planning Association. To log your AICP credits, visit the American Planning Association's website at planning.org, log into your account, and search for the name of today's event, which is Walking Toward a Healthier Maryland. You can also search for event number 9223812. So to get started today, our speakers are Michael Friedman, Dr. David Sabgir, and Dr. Olubukola Alonge. Over the course of his 50-year career as a social worker, Michael Friedman has served as a direct service provider, an administrator, a government official, an educator, and a social advocate. He retired in 2010 from his position as director of the Center for Policy, Advocacy, and Education of the Mental Health Association of New York City, which he founded in 2003. He also retired as chair of the Geriatric Mental Health Alliance of New York, which he co-founded in 2004, and as facilitator of the Veterans Mental Health Coalition in New York City, which he co-founded in 2009. After retirement, Mr. Friedman continued to teach health policy and mental health policy at the Columbia School of Social Work until 2019. Currently, he serves as chair of the AARP's Maryland Brain and Behavioral Health Advocacy Team. He writes frequently about mental health, aging, and other topics, and his writing can be found at www.michaelbfriedman.com. Dr. David Sabgir is a full-time cardiologist in Columbus, Ohio, and the founding CEO of Walk with a Doc, an international nonprofit with a mission to inspire communities through movement and conversation. Walk with a Doc started in 2005 as David realized how critical physical activity was for his patients and how much it was lacking. While the program has now spread to more than 550 communities in 37 countries, he continues to personally invite his patients to walk alongside him as a local Walk with a Doc leader. The program has since evolved to focus on not only physical activity, but also education, nature, and social connectedness. Dr. Olubukola Alonge is Program Team Manager for the Center for Chronic Disease Prevention and Control at the Maryland Department of Health. In this role, she oversees several federal grants. Her expertise as a physician and her many years of work with the State Office of Minority Health and Health Disparities provides her with the skill set to lead several chronic disease prevention and management programs. She has a medical degree from the University of Ibadan in Nigeria, West Africa, and holds a master's in public health degree from Morgan State University. Following their presentations, our panelists will answer as many questions as time permits. You can submit a question anytime by using the questions tool located in the control panel on the right side of your screen. And before we get started with our presentation, we'd like to share a brief video from MDOT Secretary Greg Slater introducing today's Walktober Walkinar program. You started it before I finished reading that.
I'm sorry. I wanted to cue it up.
And with that, we're going to turn it over to Michael Friedman of AARPs. Welcome, Michael.
Thank you. I'm trying to get the slideshow up. Can you see that?
Yes, we're good. Go ahead.
And you can hear me.
Yes, we can.
How amazing. Learning new technology all the time. Well, thank you very much for inviting me and AARP to present at this today. We're very glad to do that, and I'm going to talk, as you know, about the value of walking for mental health, or as I've called it here, for mental well-being. Even in the best of times, millions of Americans of all ages, about 20%, as a matter of fact, are living with a mental disorder, and many millions more are suffering from emotional distress that may not meet criteria for diagnosis as a mental illness, but is painful and makes their lives difficult to bear. And these, of course, are not the best of times. During the pandemic, numerous surveys show there has been a vast increase in the numbers of people with symptoms of depression and anxiety, and an even greater increase in the numbers of people experiencing significant emotional distress. Mental health organizations have put out lots of tip sheets for how to deal with emotional distress. Eat well, sleep well, get exercise, give yourself a break, and practice mindfulness, whatever that is, are on all of these lists. All good advice that I'm afraid doesn't speak to people who are living with grief from deaths before their time, people who are wiped out economically, people juggling work with kids at home, or people trapped in isolation. My view is that good advice is easy to give and hard to take. I hope that my advice today will not fall into that category. My advice, which will come as no surprise given that I'm speaking at Walktober, get out and walk. Obviously, walking is good exercise, and exercise is good for the body, but what does walking do to reduce psychological distress and to promote psychological well-being? Let me use myself as an example. Like many, many others, I am given to depression, a tendency much exacerbated by the state of the world today. When I get depressed, I ruminate about things that seem very important to me over and over. Why did I do that dumb or insensitive thing? How am I going to get everything done that I absolutely have to do, and so forth? The more time I spend by myself in my apartment, the more important these disturbing questions seem to me. They clutter my thoughts and agitate me. What helps? Getting out of myself. Walking is one way in which I do this. Not pacing my apartment, which just makes things worse, but walking outside. In bad weather, I get some relief just walking the halls of my apartment house. Even that slight change of environment helps to clear my head a bit. Better, of course, is when I walk around the harbor in Baltimore, where I have the good fortune to live. I like the water and the boats. I like seeing people going about their lives. I like running into someone I know and stopping to chat for a while. It all helps me to get away from a painfully pessimistic sense of the world that builds in my mind when I'm alone. That's the core of it. You have to get outside to get out of your head. Where outside? Well, some people swear by nature walks. They need to escape the noise and tension of city streets. They find peace in forests and vistas. Me, not so much. So where should you walk? That's a subjective matter. As I say this, I am painfully aware that many people don't have much opportunity to take a safe walk in their neighborhoods, not even in parks that were designed originally to provide haven from slum living, but have often become ill-kempt and dangerous. Nor can they jump in a car and go to a state park. It is very troubling that for something as presumably affordable as walking, poverty matters. I won't dwell on this today. Let's look a bit more abstractly at the value of walking for dealing with emotional distress. As I've already said, walking outside can help you get away from painful thoughts and feelings that are at the core of emotional distress and mental illness. In addition, walking can help to counteract the psychological effects of social isolation, which include loneliness and increased rates of mood and anxiety disorders. Walking with other people, or even watching other people, reduce the sense of disconnection. And for some people, walking with a spouse or a partner can be a good way to deal with issues between them or to experience a special kind of intimacy. It can also help people who choose to live in isolation because they are very depressed or because they have a paranoid sense of the dangers outside of their own home. For example, I once heard a psychiatric expert on mental illness and old age say that he had more hope for paranoid patients who lived in isolation but who had dogs than for those who had cats, because you have to walk a dog. Again, walking takes you out of your own head and provides a bit of contact with reality, even for people who otherwise shut themselves off from the outside world. It is also important to note that the physical benefits of walking have psychological benefits. For example, weight loss, which can be an outcome of walking, can contribute to increased self-esteem. Reduced pain, which can also be an outcome of walking, can vastly improve mood and contribute to a rediscovery of hope, which is often overwhelmed by chronic pain. Similarly, the experience of physical ability that comes with walking can help to counteract the sense of demoralization that people recovering from an illness or an injury often live with. And simplistically, increased blood flow to the brain can help to clear the mental cobwebs. In general, exercise, including walking, contributes to reduced stress, to improve sleep, to reduced fatigue and increased energy, and to improve mood, ability to concentrate, and clarity of thought. Walking can also be of benefit to people with dementia. There is some evidence that walking and other forms of exercise can delay the onset of dementia. A good reason to get out and walk, right? But even after a diagnosis of Alzheimer's disease or another dementia, people can get much the same physical and psychological benefits of exercise and walking as those without dementia, though it can be a bit more complicated. because of the fear that people with Alzheimer's and other dementias will wander away and get lost if they are allowed to walk freely. First, it is important to be clear that this fear is not warranted for many people in the early stages of dementia. They retain many of the cognitive capacities that they had earlier in their lives. But as dementia progresses, it is important for people to be in familiar environments and to develop routines. So the question of where to walk becomes very important. There need to be paths, as it were, that are attractive and satisfying and that don't have appealing exits to areas where the walker can get lost. In addition, it is important to understand that people with dementia who are wandering away from their usual paths may be doing so for a simple human reason, not because they have dementia. Perhaps they are lonely, perhaps they are bored, perhaps they are hungry, perhaps they have a toothache and have a vague memory of a dentist nearby. I had a neighbor years ago who used to get dressed to go to the movies. We tenants all knew to show her back to her apartment. So walking is good for people with dementia, and there are ways to make it safe, but caregivers do need to be thoughtful about it. So far, I've been talking about the value of walking for dealing with emotional distress, mental illness, and cognitive impairment. That's the negative side of psychology. But there's also a positive side of psychology, which is about the development of psychological characteristics that contribute to well-being. Needless to say, there's a very long list of positive psychological characteristics. But the father of positive psychology, Martin Seligman, puts them into 5 categories: pleasurable feelings or happiness, social connection, engagement in activities, achievement, and meaning. I would add such characteristics as compassion, devotion to family and community, integrity, self-worth, hopefulness, and the experience of transcendence. What does walking contribute to the development and to maintaining these characteristics? Some of it strikes me as obvious. Walking makes many people happy. Often people walk in groups. It is a source of social connection. Many people find it an engaging activity in its own right, and some people pursue it as a way that gives them a feeling of achievement. 2 blocks, the first outing, 3 miles a day now. Some of it, I think, is less obvious. What, for example, does walking contribute to having a sense of meaning in life? A recent research study looked at a type of walking called awe walks. These are walks in nature during which the walker consciously thinks about how awesome nature is, how beautiful, how grand, and how small we are as individuals in comparison to the towering redwoods or expanse of the ocean. How much greater nature is than we as individuals. You might think, as some existentialists did, that seeing ourselves as small in a vast universe of space and time would make us feel meaningless. But this research says that, quite the contrary, walking in nature with a sense of awe made the participants feel part of something bigger and more eternal than themselves. And the research report claims they felt happier, more compassionate, more grateful for their lives, more generous, and more humble. They also had a greater, and I quote, sense of wonder and appreciation of the details of the world, unquote. The point of this study was that it is not just walking in nature that promotes positive psychological experience, it is also the attitude that you bring to it. And it leads me to wonder whether you can bring an attitude of awe to a walk in an urban neighborhood, as well as to a walk in nature. It also leads me to wonder whether there are other attitudes that you can bring to a walk that would lead to a sense of meaning. For example, if you walk with a sense of social justice, what would be the impact on the development of compassion, political action, and other social sources of meaning? I don't know of research about that, but I would bet that if we look at the world we see along our walks with compassion, concern, and an impulse to action, the experience might help lift us beyond ourselves to a moral state that can be a tremendous source of personal well-being. And I am entirely certain that if we walk with an eye of an artist for the beauty that is visible to those who are prepared to see it, we can have an experience of aesthetic pleasure and of transcendence that can be a tremendous source of emotional well-being. Walking, I think, can do all that. So I say to everyone, get out and walk. If any of you who are listening at this point are concerned about your own psychological condition and you're looking for help, here's a list of ways to try to get help, and I think this will be shown several times through the course of this presentation. These slides are available for download, and once again, I thank you all for the opportunity to speak with you and turn it over to David.
Good morning. I am going to pull up my slides here. Great. Can everybody see those?
Yes, we can.
Awesome. Thank you. So I'll start with a question. Well, I would love everyone, if you're interested, to type your favorite park, either local, state, national, international, in the chat box. I'm just really curious that way. And then I also have a question. What did the number 0 say to the number 8? And if you know the answer to that, you can put it after your favorite park in the chat box. But David Sabgir, I am a cardiologist out of Columbus, Ohio, but actually in the district area now for my son's parents' weekend. And Maryland's a very important state to me. Our COO, Rachel Habash, lives in Baltimore. And I have a lot of family in Rockville. So it's an absolute honor to be here. And thank you for letting me share our program, Walk with a Doc, on behalf of Rachel, Brian, and Izzy, my teammates. So I'll go over what Walk with a Doc is, our history, growth, and some numbers. And then we'll talk about what is a Walk with a Doc, and then we'll go over benefits. Michael, that presentation was great and shared some of the things we're going to be talking about. So it's, I think it's going to fit in really well. I am not looking at the chat box, but I will tell you what the number 0 said to the number 8 was nice belt. And I can hear you all laughing, even though we're on Zoom. This is a much better looking couple than myself. But let me explain how Walk with a Doc started. Going through training in cardiology, I was at Ohio State. I was realizing that the benefits of walking, as Michael was saying, were profound and to bordering on miraculous. And we are also seeing a sedentary rate of about 95%. So I figured this will be really easy. I'll just get all my patients and their community members to go for a walk. And then by the time that all shakes out, it'll probably be about 30 years and I can retire and call it a win. Well, it turned out throughout internship, residency, fellowship, I was an absolute failure at motivating my patients to be active. So in 2004, at the start of my time as an attending or, just out of training, I couldn't take it anymore. And I asked this patient if she would be willing to go for a walk with my family and I in the park, because I wanted her to have to say no to my face. as bad as that sounds. And that just started this beautiful cascade that has led to where we are today. Our mission is inspiring communities through movement and conversation, as you see, and we will get into that. I'm very excited to share that personally, I'm super excited that this slide is a little outdated. We just hit 600 chapters, despite all of us kind of being in some twilight zone kind of a world since March of 2020 or a little earlier. So I'm super proud of our walk leaders for hanging in there and treading water and allowing us to spread this movement. It does say walk chapters are walking weekly, bi-weekly, or monthly. I would say currently about half of our chapters are active. We encourage them to go by the CDC guidelines. But we will be, I'm optimistic we're on the, Delta is leaving, and we will be paying attention and walking as our leaders see fit. Also in regards to Maryland, we have 9 chapters. These were our metrics from 2019, and we will surpass those very soon. Typical walk with, so I've been talking on this time, what is Walk with a Doc? It's just awesome is what it is. It's free, and let's get into the granular components of it. As I shared, walking for many is easy, for some it is not. And Michael's points were fantastic. And one of the great things about Walk with a Doc is you're walking in a group, which increases safety, which can be a problem for many of us. We want to show that it is doable, as Michael said, whether it's for 2 blocks or 3 miles. And all we have to do is just be consistent with it. I would say about, in regards to walk leaders, I would say about 98% are MDs or DOs, but we also have a good amount of advanced practice providers, physical therapists, some dietitians, psychologists, which, you know, as Michael was saying, is the mental health benefits are incredible. At the beginning, the leader will talk for a few minutes, and that is huge for breaking the ice and kind of, sometimes I think of Walk with a Doc as a recipe. It's kind of stirring all the ingredients together. And we've just found that that is a really special time at the beginning. Then we encourage everyone to walk at their best pace, their best distance, and there will be almost always someone there that can do that with them. Optional, we do check blood pressures, and we've sent probably countless people to see their doctor because they were higher than they thought. And then we'll also typically have water and occasionally fruit. Every system will do it the way that is best for them, and we love that. I love this little guy, great picture. So we boiled it down to these benefits. This was a survey that we did among our participants, and then we get a little more granular here in a little bit. I look at walking as twofold, as immediate, short-term, you're gonna feel it right away, and then long-term. And you know, I think the 4 things that I think of it as a Swiss Army knife, because there's just so many different things it can do. Personally, to me, it speaks to relaxing and de-stressing. If you know, sometimes we can have challenging patients in the office and situations where we may need to think about possible diagnoses and things like that. And just, I'll do goofy stuff like go out. We have a parking lot that's 0.45 miles. So if I have a break in between patients, that's my way to let all the stress, anxiety, whatever float up to the sky. And sometimes halfway around, I'll come up with an answer that may have been challenging. It also gives me energy. They say that 10 minutes of walking can give you about 2 hours of energy. As Michael was saying, it's a great way for me to bond with my wife and kids and dogs. And also I write a really goofy newsletter for Walk with a Doc, done so for the last 16 years. And to get creative, I will go out at night, and almost inevitably, that's where it comes. So that's the short term. The long term are huge. Coronary artery disease, stroke, heart failure cuts it by up to 50%. It's the best thing for osteoarthritis when you may think it may not be. There are 13 types of cancers where it takes a dramatic, has a dramatic benefit. Things you would never think of, including like esophageal cancer. I would have never guessed. Michael touched on mental illness very well. I'll just say numbers I've seen are 45 to 50% reduction in anxiety, depression, even paranoid schizophrenia. And then if you add, an appropriate medication that's a synergistic effect, it is the fountain of youth. As I see my patients that are thriving in their 90s, almost all of them are physically active. If you go to walkwithadoc.org, we've got 100 hyperlinked reasons. There are a lot of things that it does. And these are the 4 pillars of what we've seen. Back to our mission statement. It was started just a simple country cardiologist trying to get his patients more active. Now we've got all these docs, and they're doing it for more reasons than, I was just kind of simplistic with exercise. Over the years, we've learned the power of social connection, which has been driven home over the last couple of years with the pandemic. The benefits of nature, if we can get 120 minutes a week, not necessarily during the walk, but of course, being outside anytime, that shows a 30% improvement in health. And of course, knowledge is power. Number 2, education. It's as good or better for us as physicians being walk leaders than it is for the community. We get a ton out of it. We love breaking that white coat barrier, breaking it down. We have less burnout. It is so much better to be able to walk with someone for half an hour in the woods or under a set of trees on a beautiful path. You establish a whole different level of communication than being in a sterile office with time crunches and bills and copays and labs. It's just so much better. Not a substitute, but a great addition. I'm going to just point out here Amar on the upper left. He was rather sedentary. Now he takes vacations with his family to national park sites. I love that because, what a beautiful way to travel. We have a couple people with weight loss here that are featured. We've had tons of people with weight loss. That's not why we do it. Hopefully you're getting that out of this. There are so many other things. On the right, Swati, we have 50 plus minus a few walk with a future doc. So med students, again, 50 med schools are doing this, and we're trying to grow that. They all do the program. Of course, everyone who attends, it's free, but the students, we have a scholarship where they lead for free with mentorship from their professors. This is a plug for our walk challenge. We have an incredible event coming up on October 22nd, where it's virtual. There's 100 different ways to get your steps as you go through Austin, London, and Tokyo, the Inca Trail. We would love to have you join us, and the link will be there. Thank you so much. I think if we have time, this is from our leader on the Big Island of Hawaii, Hilo, and I think it's really fun. He's the one in the middle as the drone pans out.
with the air. Don't care, baby, by the way. Because I'm happy, I'm alone if you feel like a room. Because I'm happy, I'm alone if you feel like happiness is true. Because I'm happy, I'm alone if you know what happiness is to you. Because I'm happy, I'm alone if you feel like that's what you want to do. Here come bad news, talking this and that. Give me all you got.
Awesome. Thank you so much for your time. Thank you for having me. And I give it now to the esteemed Dr. Alonge.
Thank you so much, Dr. Sabgir, and thank you to both you and Michael for such an awesome presentation. I have enjoyed every bit of the presentation today. And of course, I smiled through it all. Those were really great points that were already shared. So yet again, good morning, everyone. I'd like to thank the Maryland Department of Transportation as well as Planning for this opportunity to present at the second Walkinar in celebration of October 2021, the second in the series. And the title for today, the overall title that has been shared since we started this webinar this morning, is Walking Toward a Healthier Maryland. And as I've already been introduced, I'm Olubukola Alonge. I go by Buki, and I work with the Center for Chronic Disease Prevention and Control, which is an office out of the Prevention and Health Promotion Administration at the Maryland Department of Health. And so today I'll be presenting on CCDPC, which is my center's name that just represents the Center for Chronic Disease Prevention and Control, supported walking initiatives. On this current slide, you would see what the mission and the vision of the administration is, and it's really to protect, to promote, and improve the health and well-being of all Marylanders and families. And the process by which we do that is well detailed on the current slide. So for this portion of this webinar, I have a couple of objectives, things I'd like to accomplish. Some of them that I've actually already been touched on by both Michael and David. And first is to understand the health benefits of walking and identify what initiatives that support walking that are being done by the center. And for the third point, which is the objective here, as we all know, we're in a pandemic at the moment, and our local health departments are really working closely with their local jurisdictions, providing vaccination, helping to guide people for screenings and whatsoever that they need to maintain the health of their citizens. So I would not be providing much information about how to connect with the health department, but at the end of the slide, you would have my own contact details, and if anyone needs more information about how to connect with their chronic disease officers at their local jurisdictions, you could reach out to me and we'll be sure to navigate you. So the first thing I'd like to say is that we've said a lot of things about walking, and I'm not sure if everyone knows, but walking, Maryland actually was the first state to designate a state exercise. And it's interesting that walking is the Maryland state exercise, and that was signed into law, I believe, in October of 2008. And so since then, we've been doing several activities in celebration of Walk Maryland, things like the Walk Maryland Day that we'll talk about later. And I also wanted to stress that when we're talking about walking towards a healthier Maryland, it's important for us to know that this cannot be done in silos, right? We all need one another to be able to do that. We all need, health needs to work with transportation, transportation needs to work with planning, we need to work with our schools, we need to work with our aging, we need to work with our local community-based organizations. We all need to do that collaboratively. And so my center and our department is always seeking out opportunities to collaborate with other organizations to support initiatives that support health and help to improve the health of all Marylanders. On the current slide, you would see the physical activity guidelines for Americans. This was written in 2018 and was provided by the Department of Health and Human Services. And on this slide, there is also a link that would lead you to that document. And it shows us what exactly is, there's been a lot of research, and it's been proven that if one is able to get at least 150 minutes of physical activity weekly, one is able to maintain good health. And we know that physical activity could be all inclusive. It's actually, there's several types of physical activity, but why are we owning in on walking? And we'll talk about that in just a few minutes. And on this slide as well, it also shares for children, what is the expectation for them as well as related to physical activity. The current slide also shows a document that was also from the Department of Health and Human Services, and it's titled Step It Up, and is the Surgeon General's Call to Action. And I find this very interesting because I'd like to read out the goal, because I find that really interesting and something that we should all own in on in every work that we do in our different careers. And the goal says that the goal is to increase walking by working together. What I already mentioned, we need to work together to increase access to safe and convenient places to walk and wheelchair roll, and to create a culture which supports walking for all Americans. What that means is that we cannot, like I mentioned before, we cannot do this individually. We need to come together. We have to find a way to promote access to safe and convenient places to walk. I think the two prior speakers already touched on this. Access to those neighborhoods is a big thing in some communities. And so we need to all, in work that we do, think about how to improve the communities that people walk in. We're asking people to walk. Are there sidewalks? Are the streets safe? We need to be able to make sure that we support initiatives that help to promote access to such neighborhoods. And we can also see here, as part of the goal, it talks about wheelchair roll. It means that everyone can walk. It doesn't matter what your ability or your disability status is. We can all walk. If I'm in a wheelchair, I can walk. If I'm using walking support, I can walk. If I do not need any support, I can walk. Everybody can walk. And that is why it's also important in our work, in the work that we do, to also think about accessibility, not just in terms of access to safe neighborhoods, but even access by all individuals, no matter their ability. And it says, finally, to create a culture. It is a culture which supports walking for all Americans. I find this like an all-inclusive goal that should be a mantra in whatever we do. And so there is also a link that would lead you to that document where you could read more about what the Surgeon General had shared and the different steps that one could take. And before I proceed on to my next slide, I would like to just share that the Behavioral Risk Factor Surveillance System, we call it BRFSS, is something that is done in all, it's actually a telephone-based survey that is conducted in all 50 United States, as well as the District of Columbia and the 3 US territories. And there are three things that the survey, there's data on three things that the survey collects. It collects information about health-related risk behaviors. It collects information about chronic disease conditions that people have in the different jurisdictions. And it also collects information about how people are utilizing preventive services. In 2017, the survey that was conducted in Maryland showed that 51% of Marylanders engaged in the recommended 150 minutes of physical activity weekly, 51%. So that should lead us to think about what happens to the remaining 49%. And this is all inclusive physical activity, not just walking, meaning there is an opportunity to do better as a state as related to increasing physical activity amongst us. And why does that matter? The same survey when it was administered found out that 47% of the participants, 47%, said that they did not feel safe in the neighborhoods all the time. And that was the reason why they were not participating in walks, for example, or being out there. Like we've all said repeatedly today, we should go out there and exercise. 47% of the individuals that were surveyed said that they did not feel safe in their neighborhoods, and because of that, they were not participating in walks, or they were not out there doing anything that could support increased physical activity. Moving forward, fast forward into 2019, the same survey showed that 67.9%, that is essentially 68% of all Marylanders were either overweight or obese. I think we've already established today that being overweight and obese has a lot to do with other comorbidities that could happen down the line. Is it cardiovascular disease? Is it the risk of suffering a stroke? Is it the risk of becoming pre-diabetic or even becoming full-blown diabetic that comes with all its other attendant conditions? Being obese is a precursor for all those other conditions. 68% of Marylanders in 2019 of those that were surveyed were either overweight or obese. That means that we have a lot of work to do. So then I go to my next slide that talks about, so why are we talking a lot about walking? And we've said it several times, walking is free, really. We do not need any special skills. If you can walk, you can just go out there and walk. It's as simple as that. And it's modifiable for all populations. I think it was David that mentioned that even for osteoarthritis, that's like the best treatment for it. Initially, it might be painful, it might be uncomfortable, but with more that you do, it helps to support strengthening the joints, maintaining or reducing weight, all things that could help to improve outcomes. So it can be modified for all populations. It can be modified. It doesn't require any gym membership or any expensive equipment. All you need are your walking shoes and a safe neighborhood, and you're out there walking. And definitely it's been shown to have proven health benefits. So I would not belabor this point because I believe these points have already been talked about in terms of weight loss. Maintenance is another thing. It's not about just losing the weight, but even maintaining when you are the right weight, when you are the right BMI or whatever the appropriate weight for your height is, when you are that, you even need to be able to maintain that, and walking helps to support that. And a couple of other points that have already been shared. And on the slide, you'll find a link that also would lead you to a detailed writing from the CDC about what the benefits of walking are. So now I'll switch gears a bit and talk about what my center, as part of the Maryland Department of Health, does to support walking. So we like to think about walking about the life course perspective. Health should be talked about right from the cradle to the grave. It's something that we should all talk about. Those behaviors do not just suddenly start in adulthood. It's important to know that if I didn't have those behaviors before, I could always take them on. But even better is to integrate these learnings and these behaviors into kids while they're young. So my office, as part of this support of initiatives for children, works with different jurisdictions, the counties in Maryland, to promote the Safe Route to School program. Safe Route to School is an evidence-based program that is out from the Maryland Department of Transportation. And basically we work with we work a lot closely with our health departments because we're health, but our health departments work with the different partners in their communities to implement programs. One of them is a Safe Route to School. At the top of the slide, you would see the Bike Play Safe Court that was implemented by the Washington County Health Department in partnership with the schools in their jurisdiction and with the YMCA in Hagerstown. They created this court to allow kids to come to take lessons about how to bike safely and actually to use that as a practice model. And that is one thing that we've been with the Washington County Health Department for a couple of years, and this is one of the things that they accomplished in the last year, apart from offering trainings to kids about how they could safely bike in their communities as well, bike and walk. And the lower part of the slide also shows, so in the last year, we worked with Somerset and St. Mary's counties as well as Washington County. And in Somerset and St. Mary's, they worked with their school jurisdictions and did things like the walk to school days, the bike and walk at school days. They did different events. They made their crosswalks much more safer with the use of planters, with the use of crosswalk, with the use of walk ambassadors and people and other initiatives like that. And one of the outcomes that came out of what they did last year was that they created a Safe Route to School plan for their jurisdiction that helps them to improve access for children in terms of improve how students are able to walk to school, to walk to libraries or places that they need to go in their communities. And part of the things that they got from this was that there were things that we could not support that might require them some engineering changes that they are able to do. So doing things like this, children have been interested. We've started building in them an interest in walking or biking, things that could support their health as they grow into adulthood as well. The next two slides, I would just touch base on a couple of things, and I've put links there because I know that we might not have enough time to talk in details about them. So there are links there that could lead you to pages that will give some more information about these different initiatives. One is the taking of pounds sensibly. This is a model that is already out there. That is the link to the website that will give you a lot of more information. So this model just supports a group of people coming together. We've talked about that social networking already today. So people coming together to exercise together, to learn how to eat better, eat right together. And so in our office, through funding provided by the CDC, we support some of these initiatives in some of our jurisdictions. I'm actually currently in Garrett and Charles counties. And what this does is we're really targeting individuals that have high blood pressure or that have high cholesterol, and they're being referred by their primary care providers to these programs, because we know that with increased physical activity, with increased walking, one is able to lose weight, and then all those other parameters can be better controlled. So that is one initiative that we have ongoing. And there is a link to something that I would like everyone on this call to actually look into. It's called the Maryland Walkability Virtual Academy, and it's something that we're just about to start. This is actually going to start in January, but applications need to be in by the first week in November. I believe that's November 5. So this is an initiative that we're partnering with National Association of Chronic Disease Directors on. And with this initiative, we want to improve walkability in Maryland communities. So part of the things that will be done is they would, the individuals that participate in this academy will get training from different experts that will teach them how to do walk audits in their communities, how to find out the areas of need and how to improve access to walking. We've talked about safe neighborhoods. We talked about the fact that there are no walkways in some areas. So just things to improve walking in your communities and how to engage people in your different communities. And there are particular guidelines that are associated with this, which you would find on the provided link. The diabetes prevention program, the self-management program, the chronic disease self-management program, these are all initiatives that also support walking, either to prevent these conditions that are chronic or to help to manage them better. Walk Maryland Day, we just all finished that. And for all that participated on Walk Maryland Day, we really would like to appreciate you. Like I said, walking is the state exercise. And so every first Wednesday, every year, we usually would celebrate Walk Maryland Day. This we do in partnership with several of our partners, in partnership with several organizations statewide. We work with MDOT, we work with MSD, we work with Aging, we work with planning, we work with other health department offices, we work with AARP and a couple of other organizations to ensure that on Walk Maryland Day, there are several walks that are coordinated and done statewide. However, we do not want this to end on Walk Maryland Day. This is an initiative that we want us all to participate in year-round. NICPAD is another thing that we work on, and this is about inclusive, even individuals with disabilities in everything, even in walks and in every preventive program that we provide. So we do this in partnership with Washington, and I believe that's Charles County. And so that's an initiative. You can learn more about what NICIP is on the provided link. And the final thing here is the State Advisory Council on Health and Wellness. So this is a council that has various experts that come to talk about how to better the health of Marylanders, of course. And one of the committees on this is the Fitness Committee, and one of the things that they're tasked with doing as well is improving walking amongst Marylanders from kids to adulthood. And so to learn more about that as well, you can please access that link. Here is the proclamation from for Walk Maryland Day 2021. And that, of course, is the logo that I'm sure you've seen severally. And this is just a sneak peek from the walk on the 6th of this month at the State Health Department. And how I walk, like I mentioned before, it doesn't matter what your ability is, we can all walk. And so this is something that is out of NICPAD as well, in support of all populations being able to walk. And I'd like to thank you for your time. And I know it's about time for me to round up. And on the slide are my details if you would need to contact me after this webinar. And I'd like to turn it back over to Michael. Thank you everyone for your time. I appreciate it.
Thank you, Dr. Alonge, and thanks to everybody who has submitted questions here. And I know we've shared a lot of information and have sent out a number of the links through the chat function here. We will be posting all of the presentations on our Walktober Walkinar page, and we'll be sending out a link to everybody here today to that once the recording has been posted there. So there's a lot of good information, not only today, but last week and the upcoming week. So as I mentioned at the beginning, we're just going to be continuing to compile that, and hopefully you'll be able to access that and also to share that with all of the people that you're working with in your communities. I think the great thing about this Walktober Walkinar series is that we've got a lot of good information from experts that is getting out there as well. So please take advantage of that opportunity. So I'm going to ask our panelists to turn on their webcams for us so that you can see them during the questions and answers. And then if you want to continue to submit them through the questions tab, please do. And we'll just go ahead here till noon. If we run out of questions early, we'll end a little early, and I'll ask our panelists for some closing thoughts. But in the meantime, thank you also for submitting some of the responses to Dr. Sabgir's question about your favorite locations to do walking. And I'll just list some of these things so that he can hear them. And David, if you can turn on your cam, that would be great. So some of the favorite places that our audience members like to walk are the Leonardtown Wharf, Assateague, which is a very popular place. So the Watkins Regional Park in Upper Marlboro, Maryland. We have somebody here from Columbus, Ohio, who likes to walk through the city. Wilmer Park in Chestertown. Sarah Will likes Shenandoah National Park. Lois McKnight loves Yosemite. More local to us here, Herring Run Park in Oregon Ridge. Around Baltimore, Lake Montebello, the Crosby Arboretum. There's a great creek walking area, Rock Run, out of Ralston, Pennsylvania. One of our MDOT colleagues likes to walk in the woods near his house. The Y Island, nice belt there to walk around. And Great Smokies National Park and Sugarloaf Mountain and Little Bennett State Park. So it sounds like a lot of people in our audience are enjoying getting out there and doing just what we're talking about today. So just wanted to share those with you. I don't know if David, if you wanted to respond to any of that, and you'll need to unmute.
Great, sorry. Yeah, I'm just adding to my bucket list here. It gets me all juiced up to hear about these wonderful places.
Great. Yeah, I know David was just traveling to the area here yesterday, so maybe you'll get a chance to enjoy some of these before you go. And one more, Carroll Park in Baltimore City was also mentioned. Okay, so given that, I guess as a follow-up, David, question here from Samantha Pearson, who asks, are Walk with the Doc groups or the organization overall involved in working on improving physical infrastructure for walking through planning and policy?
Not as much as we should be. We've been blessed to have meetings in Atlanta with the CDC, Dr. Alonge's team, and we would love to have our participants be walk auditors where they can participate in that. And it's something that is in our future plans, and we hope sooner rather than later. But thank you for bringing that up. It's incredibly important.
Okay, thank you. One of our audience members had to jump off, but wanted to give you a shout out. David, love what you're doing and supporting them with an AARP Georgia team during the 2021 Walk Challenge. And so big thank you to your staff as well. Just wanted to share that with you.
Thank you. That was probably my mother.
Okay, excellent. So here's a question from Owen Bailey to both doctors on our panel today. Is there any evidence on the return on investment with pedestrian infrastructure in regards to public health? Meaning, how much can we save in health costs by building protected places for people to walk?
Doctor, I'll defer to Dr. Alonge. I don't know the numbers. I mean, anecdotally, I'm sure there are. I know that doesn't help, but I'll defer.
Well, first and foremost, I'd like to say that my team is with the Maryland Department of Health. We're funded by the CDC. And to that question, I would like to stay with David and say anecdotally, I could say that as well. I'm sure I do not know what those cost savings are, but I am definite that they are cost savings. But I know to put my hands and say this amount translates to this, I would need to do some further research on that.
Okay, and some of the other panelists in the series are more focused on infrastructure than this one, so we may be able to ask that in one of the follow-up webinars here. Okay, here's another common question. Walking is wonderful, however, my concern is about the poor air quality of most urban areas. What can you suggest other than driving to green spaces far outside the urban area to have more healthy walks in urban areas? Which of you wants to take that one on?
I'm happy to start. Certainly an issue, and we were walking with a friend here in DC, and they were talking that there's a flight every 90 seconds out of Reagan, and that has changed the air quality. So an overwhelming concern. I guess my take is that the benefits still are going to far outweigh that the issues. I think now that we're walking with masks, specifically N95s, that may very much help in that direction. And I know a lot of us are unable to get to nice areas. I mean, here in DC, this morning we went around Theodore Roosevelt Island, which felt a little cleaner because of the trees. So I would encourage you to find some nature respites, if you will, but I know that's not always possible. In that situation, if you're uncomfortable, I'd go with an N95.
So I agree that the benefits outweigh the risk, and walking is good outdoors. It definitely has benefits, but indoor walking is another recommendation. I think more importantly, just keep walking, keep practicing that. Include that in your day-to-day living, be it outdoors or indoors. So if that is a major concern, and you're not able to get to a clean environment, somewhere that you think the air quality is better, you might think about doing it indoors. In some scenarios, like has been mentioned, if you're using your mask as well, that also is appropriate. And just to talk a bit about air quality and everything, it also has something to do with us all. So we're talking about climate change. So in our own little spaces, in our own living, whatever we can also do to support an improvement in air quality. I know there are things that are beyond us. There are policies that are put in place. There are companies that are in the areas where we live that we have no control over. But for the things that we can control, let's just continue to contribute to improving climate change, improving air quality and everything. So if it's impossible outside, you can walk indoors. Just keep physical activity going in whatever way you can.
Great, thank you. Next question here, I guess we'll send over to Michael and maybe Dr. Alonge and Dr. Sabgir can also respond. And that is from Nicholas Johnson, who's asking, is walking being suggested more frequently by mental health professionals to treat anxiety and depression?
What an interesting question, and I frankly don't know the answer. I would say that mental health professionals ought to be saying to people that exercise and walking would be helpful to them, but I have no idea whether practitioners, in fact, are building that kind of recommendation into their practice. Certainly, if you read the literature, you'll find lots of things that relate to the value of exercise and walking. But again, the specific question here is, are the mental health practitioners actually recommending it? I don't know. Good question.
So I'll just mention quickly that not for mental health, but I know that my center at some point collaborated with the different health departments to give something that was called like a passport to health, where individuals are given like a prescription to actually, and that was in collaboration with their parks and recreation, with the parks and recreations in their counties, where people are given a prescription to go there to actually walk the trails or to do something out there. So I'm not speaking to mental health, but I'm saying, and I think Dr. Sabgir has also mentioned the fact that we're promoting this. Physicians are promoting this. And I'm just saying that in Maryland, there was a time where there were some referrals that you could take out to get a pass to walk in those communities. So definitely, it can only be beneficial. Yes.
I'll just add that we, thanks in part to a lot of things, but we were getting back in, 05, 06, 07, when we were starting, we were getting 1 request every 6 months. Now we're getting 6 to 8 requests a day from doctors to start. And there have been a lot of psychiatrists and psychologists that are entering, and that number is increasing. That's just internally within Walk with a Doc, but I have to believe that's probably a reflection of what's going on nationally. And of course, we need this to be ideally every single psychiatrist and psychologist and mental health professional is recommending it.
Do you have psychiatrists, psychologists come on the walks with you with their patients? You made it a point about how it changed your relationship with patients to get out and walk with them. And there generally is reticence on the part of mental health professionals to get sort of personally connected with their patients. So it'd be very interesting to know whether you're getting people to come out walking with their patients.
Sure. They're not coming with me, but they're going in whatever part of the country they're in. It's not hundreds, but we've definitely had dozens of psychiatrists and psychologists that have offered up to provide this as a service for their patients.
Interesting. Big change in practice for them.
Great, thank you. Next question here is from Sarah Davidson, who's asking, what can we do to advocate for the maintenance of trees and open space in communities that are transforming over time to less community accessible high-rise development? This is related to walking opportunities.
I'll jump in. We've had a lot of our doctors ask their local legislators to attend their walk chapters at whatever level of government. I think there's nothing, first they're walking with them out in a beautiful, relaxing space and bringing attention to it. I will also say we've been honored to start working alongside the National Park Service for a couple things. And one thing that we're both very passionate about, as is everyone, is climate change and the ill effects. So having those conversations, there's not going to be any progress without having the conversation. So I would encourage you to invite whether it's city council or your representative in the US House to come join you and have those conversations.
Great, thank you. One of our audience members, Laura Conley, I believe, is saying that as a walking wellness coach, many doctors and therapists have referred people to walk with me, and I'm seeing a big shift in Houston.
Yeah, I'm sorry, I feel like I'm talking too much. It's wonderful to hear. we've got an amazing partnership with the Texas Medical Association. There's 50,000 docs there in that group, and we've been partners now for 9.5 years. And the TMA has been incredible at promoting the effects of walking, and I would probably give them a lot of credit for that.
Okay, thank you. Next question here is, have you heard of health insurance companies that promote walking as part of a financial incentive program to improve people's health?
Well, there are certainly health insurance companies that provide for free gym membership. And for people who are old like me, there's Silver Sneakers, which is often built into some of the supplemental Medicare coverage and so forth. So there's no question, but that insurance companies are aware, particularly the HMO-like insurance companies, are aware that getting exercise is good for your health and helps to hold down health costs. To get back to an earlier question, the HMOs have built into their model providing free exercise opportunities, in part because they know it brings down long-term healthcare costs. I don't know what the data are, but it's obvious that's part of the reason that they do it. I don't know of insurance companies that send out notices to their members saying, why don't you go take a walk? But I wouldn't be surprised. I haven't gotten one of those. It's a good idea, actually. Let's get the insurance companies to.
Okay.
And then what they need to do, of course, is to give us a discount for doing it.
Yes, an incentive there. Here's a kind of a related question here, which is, in years past, many of our malls served as safe walking environments for senior citizens. With the shuttering of older, underutilized malls, are there strategies and examples of walking for senior citizens in these communities?
I would love for you to see if there's a walk with a doc in your community. It's a great way to get together. I know the YMCAs have been very supportive, and if a lot of school gymnasiums are opening themselves up to our walk leaders that want to do that. So shameless plug, but if you don't have a walk with a doc in your neck of the woods, please reach out to us, and we have ways to help facilitate that happen. I think walking in a group, for all the things we've talked about, is that social connection. You could argue it's equally as important as the physical activity.
I think it's very important to address the issue of safety. Dr. Alonge talked about that. I think there's a very fundamental question about whether neighborhoods are safe to walk in, and given particularly the concern that has increased now about health disparities, where are the health disparities? Where are populations that have poorer health than other populations? And the answer is largely among people who are poor and people of color. And these are people who are living in places where walking is probably not the best thing to do from a standpoint of safety. So I think that needs to be addressed as part of the health disparities initiative, as well as just promoting health through exercise.
Yeah, and I could not agree more. And I think that's why we cannot overemphasize the importance of working collaboratively. Because, for example, health alone or AARP alone or walk with a doc alone cannot do this. That's why we all need to not walk in silos. We all need to come together, because different people can bring in different pieces. When we talk about safety, we need to bring in our DPESC. We have to bring in planning for our walkways. We have to bring in transportation for our pedestrian walks, things that support lighting in the environment and things of that nature. And other things that even support social determinants of health. If people are homeless in the community and there's a lot of homeless persons out there, it might be difficult to take walks there because you're scared for yourself. And so everybody housing, everybody coming together to do this is not an individual or an organization's job. And just to the question about about some malls being closed and everything. I think to David's point, it's just important that as long as people are able to walk as a community, it doesn't really matter where, as long as you feel safe in the environment. It can be indoors, it can be outdoors. If you feel comfortable where it can just be a walk, even for senior citizens, just around your neighborhood, just with other neighbors, other friends in the area, and you just walk together. And just having somebody be the lead, it's not really anything, it doesn't have to be too structured. Just a couple of people agreeing to be out at a particular time and take a walk, because you're able to accomplish taking that walk and getting the benefits. It doesn't have to be structured. Of course, you can get a walk with a dog in your community, but we can just keep moving just if we come together and just decide we want to walk at this time, this designated time of the week, or something of that nature.
I was struck at the beginning when, Michael, I guess it was you who read off the places that people like to go to walk. I didn't hear anybody say they like to take a walk through a nice urban neighborhood. Did I miss it? Everybody seemed to be talking about nature walks, some of which are available in Baltimore, where I live. There are some nice nature walks in town. But you know, there are people who really don't want to go walking in nature. There are people like me who find that really boring. I mean, just boring. I like walking around urban neighborhoods. I've traveled around the world. I try to get into the neighborhoods that'll give me the sense of who the people are. And that's what interests me. There are other people like me out there too who are not going to be getting great pleasure out of walking in nature. They'll get pleasure from something else, as I tried to suggest at the end of my remarks. So I think it's very important to pay attention to the urban environment, which is what we're talking about, and the possibility of people being able to walk safely in urban environments.
Yeah, one of our audience members just made the comment that having more eyes on the street by having more pedestrian walkers can make neighborhoods safer. So that's also an observation there, connection between walking and public safety. I'm going to go back to something that Dr. Alonge just referenced, and because we actually had a question about it, and that is when do the physical components of the social determinants of health, such as environmental approaches, enter the public health discourse? Is that something that you can answer?
So, and maybe Dr. Sabgir can talk a little bit about more around that as well, or even Mr. Friedman. I believe it's a couple of years. Like we know, language changes, but the same concept in public health. At some point, it wasn't social determinants of health, but I believe social determinants of health has been something, I'm not able to place my hands exactly on when, but I would think maybe within the last 10 years thereabout, as a concept. Social determinants of health being those things around people that impact health. Not just going to your healthcare provider and finding out if you have a condition, but those things that trigger you getting to that point, the circumstances that you live in, the kind of access that you've had, kind of advantages or disadvantages that you've had all through your lifetime that can impact your health. So I think the nomenclature might have changed, but the concept has been there. So with regards to timeline, I would want to say maybe 10 years, but I'd like to see if other panelists have insight on that as well.
So it seems to me that while talk about social determinants of health is a little bit new, addressing social determinants of health is not at all new. If we go back into early in the 20th century, there was a huge focus on improving sanitation in cities. There was a huge focus on changing requirements for living conditions so that people would no longer be allowed to live in cold water flats. So over the years, there's been an enormous amount of attention, it seems to me, to that type of environmental social determinant. In New York, where I come from, there was a big focus on the relationship between asthma and where the bus depots were located. Mm-hmm. They changed the rules about buses running when they were sitting in the depots, spewing out noxious fumes. and they also started to move the bus depots. When I was on the advisory committee to the Commissioner of Health in New York City, there was a big move to change the quality of oil that was used in buildings, so that the health department was paying a lot of attention at that time to something as maybe arcane as, can you use number 4 fuel or number 2 fuel or number 6 fuel? I don't even know what these things are and how they differ, except that some are dirtier than others. But I think that has been, certainly since early in the 20th century, and if not in the 19th century, that's been a major part of what public health does.
Great, thank you. So I guess another question for you, Michael. You mentioned in your bio, the work that you're doing with AARP's Maryland Brain and Behavioral Health Advocacy Team. Wondering if you could tell us a little bit more about that group and what it does and how it might relate to what we're talking about today.
So this is something that we organized about 1.5 years ago. We're now called the Cognitive and Behavioral Health Team, which relates to the fact that the Maryland legislature has passed a mandate that the state of Maryland develop a multi-year plan to address the cognitive and behavioral health needs of older adults in Maryland. So we've adopted that terminology. The work that we've done has focused to some extent on telemental health, which has been an enormous improvement in access to care during the pandemic. Hopefully it's something that will continue. But we focused heavily on persuading the state of Maryland to pay attention to the cognitive and behavioral health needs of older adults, which I'm sorry to say, Dr. Alonge, we perceive as seriously neglected by the Maryland Department of Health and the Maryland Department of Aging. So we've been focused on that work. We're hoping that a plan that was a report that was mandated as part of the state budget, whether it was due on October 1st and was not released on October 1st, will be released sometime soon. We will keep advocating for that, and we are, again, to be repetitive, urging the state to identify and start to come to terms with the cognitive and behavioral health needs of older adults. Just to translate that, cognitive refers to dementia and those kinds of disorders, and behavioral is a mix of mental health and substance abuse. So that we're concerned not only about depression and anxiety and psychotic conditions, we're also very concerned about the misuse of substances by older adults, particularly alcohol, which is a very serious problem among many older adults, so that somewhere around 20% of older adults are overuse alcohol, not necessarily addicted, but overuse alcohol. And a stunning number I came across recently, 50% of people like me who have chronic health conditions for which drinking is a very bad idea, 50% of us drink anyway. So alcohol is sort of high on our agenda. We have not gotten to this issue. So in fact, inviting me to speak will sort of build consciousness within our group that walking and other forms of exercise we should be paying attention to.
Great, thank you. Just looking at where we are with the time, I'll just ask, I guess, one final question for David, because there are a lot of folks who are interested in what you were talking about with Walk with the Doc and how they can get involved and organize. So several questions here that are all related. How do we connect to Walk with a Doc? Is there a list of doctors available that participate in this program? Are all walks led by a doctor? Do I need to be a patient of a specific doctor to participate in a walk? Is there a charge for it? And if so, is it covered by health insurance?
Thank you for those. There's no charge, and it is, if you do not have a walk with it, well, the website's walkwithadoc.org. You can get a hold of me at the email on the screen, or also contact@walkwithadoc.org. We'll get one of our teammates, and we've got letters you can give to your doctors, and it's pretty easy to get started. I think for all the reasons we talked about today, it's really critical we have as many as possible. And I'm sorry, I'm sure I missed one of the questions in there, Michael.
I guess there was also some questions about, do you need to be a patient of a specific doctor,
yeah.
and is there a charge? Okay.
No charge at all, and no, you do not need to. For example, the walk I lead, about 10% are my patients, and the rest are people that were invited by patients. But we've been very fortunate that once a chapter starts, it's essentially inevitable that the paper, radio, TV will pick it up and put it out, over the airwaves, and people will hear about it by that or word of mouth. So you do not need to be in. What a great way to get a second opinion. I've had countless people over the years ask me if their doctor is doing the right thing, and far be it from me to do that, but I can also offer my input on questions they can ask their doctor, or if it's that blunt, I can share my opinion as well.
Great, thank you. Sounds like that's really taken off here in the last few years. Okay, well, given where we are on the time, I will just offer our panelists an opportunity to give us any kind of closing thoughts and takeaways, and maybe some inspiration to get out there and walk. So maybe I'll just start with you, Michael, to see if you have any closing messages for us.
And I don't particularly, except to repeat what I've already said, which is that there are a lot of people who suffer from mental illness. And there are a lot of people, particularly during the pandemic, who are experiencing emotional distress, which is very tough for them to deal with, even if it doesn't reach the level of being a diagnosable mental illness. And getting out is something that can be very helpful to all of that. So get out.
Thank you. Dr. Alonge?
Yes, thank you. Regarding final thoughts, a few things I'd like to say, which have been said before. Walking is free. We can all take walks, no matter what our ability is. Recommend that you do that, not just during Walktober or in celebration of Walk Maryland Day, but we should try to integrate it into our daily routine. And we would all see what the benefits are to our health as we continue to participate in this. And just knowing that we cannot do it alone. In whatever we do, we should not work in silos, but we should work collaboratively to better the health of Marylanders. And those would be my final thoughts. Thank you.
Yeah, thank you. So we'll give the final word then to you, Dr. Sabgir.
Oh, thank you. I would say, traveling in DC, a little stressful. So I have found that for a country kid like me, I've found that like walking has helped de-stress. I would say baby steps. So if this is not part of your routine yet, baby steps, and this thing is a pedometer, I would encourage you to kind of keep track of where you're at. Say you get 3,000 steps today, maybe shoot for 3,300 tomorrow. Just and celebrate that, because from what these great panelists, self-excluded, have shared, the benefits are endless. So just getting out, next time, moment of stress, take a little walk and keep yourself accountable with a pedometer. It's a great way to be aware of what you're doing and reap all these incredible benefits.
Great, thank you. And thanks for everybody participating today. With that, we're going to conclude our webinar, Walking Toward a Healthier Maryland. I'd like to offer a great big thank you to our speakers for a great presentation, to everyone who attended today, and to Francine Waters and Brittany Brothers of MDOT who pulled this series together, as well as to John Coleman, our communications and technology guru, who managed the technical aspects of the program today. The complete recording of today's webinar will be posted online, and our participants today will be sent an email with a link. When you exit from today's webinar, you'll be asked to participate in a short evaluation. Please take a few moments to provide feedback so that we can continue to improve the webinar experience for you. Finally, please join us next week and every Thursday this month as we continue the Walktober Walkinar series. In addition, we are hosting 2 Smart Growth Network webinars in the next week, including Recast Your City, How to Save Your Downtown with Small Scale Manufacturing with Alana Preuss at 1 p.m. Eastern tomorrow, and Local Strategies for Equitable and Sustainable Transit-Oriented Development next Wednesday at 2 p.m. Eastern. Visit smartgrowth.org for more information about these programs and to view our webinar archive, which includes recordings of past programs. And with that, I wish everyone a great day.